Hi dear doctors, welcome to the class of Kidscovery. My topic of discussion for today is the most important topic, that is Chiari malformation. In one or the other videos, I have even asked you to tell me in the comment section what is Chiari malformation. So please understand, now Chiari is of two types. One is called as Chiari malformation type 1, another is called as Chiari malformation type 2, and this is the Arnold-Chiari. Actually, Arnold-Chiari is a word which is used for both, but technically Arnold-Chiari was the word which was used in context with the Chiari 2 malformations. Okay. So what is Chiari 1 malformation? Please understand that this is the cerebellum. Okay, can you see this is the cerebellum, and cerebellum is going to come down. Okay, so there is a downward displacement of the cerebellar tonsils. There is a downward displacement of the cerebellar tonsil which is going to happen in Chiari malformation type 1. Whereas in Chiari malformation type 2, what is going to happen, that there is of course the downward displacement of the cerebellum, but there is downward displacement of brainstem also, there is downward displacement of fourth ventricle also, and since there is downward displacement of the fourth ventricle, this causes a stenosis kind of a thing, and that is going to cause hydrocephalus. Now hydrocephalus, how it is going to be formed because of your stenosis, I have explained in another video. If you want, I'll give you the link in the description and you can go and just have a look on it. So Chiari malformation, please understand there are three types. One is Chiari malformation 1, Chiari malformation 2, two types actually. So let's quickly understand. You very well know Chiari 1 means downward herniation of cerebellar tonsils below the foramen magnum, whereas you have got the downward herniation of the cerebral vermis, of the tonsils, of the brainstem in Chiari 2. That is why please understand that this is going Chiari 1, since your what is going to happen, there is the cerebellar tonsils are going to come down. Why is it so? Because there is a congenital underdevelopment, or there is a small posterior fossa. So because the posterior fossa is itself a very small thing in these patients, of course the cerebellum has to come down. Okay. Whereas if you see in Arnold-Chiari type 2, there is a neural tube defect which is going to be there. That is, there is a neural tube defect. Mind you, there is a neural tube defect which is going to cause the herniation of the brain structures. Okay. So please remember that 2 is equal to new, that means a neural tube defect, whereas 1 is going to be just the small posterior fossa. 1 is smaller than compared to 2, so 1 is small, so smaller posterior fossa is going to be there. There's going to be Syringomyelia. Now what do you mean by Syringomyelia? See, in the spinal cord, in the spinal canal, there's going to be air entrapment, there can be water entrapment. Okay, so please understand this. Syringomyelia, Syringomyelia, all these things can happen in this. And what happens, what is going to be there in Arnold-Chiari type 2, please understand, in type 2 there is a myelomeningocele which is going to be there. So your meninges are going to come out, your part of spinal cord is also going to come out in case of your type 2. So there is going to be myelomeningocele, hydrocephalus, both of them can occur. So in type 1 there is going to be spinal cavity formation. In type 2 it is associated with open spinal dysraphism. What is dysraphism? So remember, there is a defective closure. Okay, so it is not properly closed. That is why, can you see, this is open and coming outside like this. Okay, so this is something which you have to understand about Chiari 1 and Chiari 2. So Chiari 1 is seen in adulthood, whereas Chiari 2 is something which is seen at birth. That's why I have told you that new to these both words are actually rhyming. Okay, so what will be the symptom? Of course, ataxia, disequilibrium, dysmetria, these are going to be the symptoms because the cerebellum is involved. But remember that there are some brainstem signs also which are going to be seen if it is Arnold-Chiari type 2. So both are going to cause the cerebellar compression symptoms, but then brainstem dysfunction symptoms are there in case of Arnold-Chiari type 2. So what are those brainstem symptoms? Like, there will be feeding difficulty, there will be stridor. Why there is stridor? Because of the 10th cranial nerve involvement, that is supplying your palate muscles, your pharynx muscles, your larynx muscle, and since these muscles are not functioning properly, there will be stridor, apnea, weak cry, lower cranial nerve palsies can also occur, whereas something like dysarthria, dysphagia, hoarseness of voice, nystagmus, all these things can occur in Arnold-Chiari type 1. Okay, so please understand the speech issues mainly. They are swallowing issues, speech issues. They are something which are seen in your, you can say in your type 1, whereas type 2 is something which is more severe because it is going to have the respiratory involvement. The respiration is involved in type 2. Now, Syringomyelia, as I've told you, okay, let's just understand about the some symptoms like, there will be pain, there will be paresthesia due to Syringomyelia. Now, what is Syringomyelia? Please understand. See, because of something which is called as spinothalamic tract, okay, from the spine it is going to the thalamus, from the spine it is going to the thalamus, okay, and it is carrying what? It is carrying the temperature sensation. They are going to decussate, okay. So, spinothalamic tract is something which carries pain and temperature sensations, okay, temperature and pain sensations. They are going to decussate, they are going to cross in the anterior white commissure of the spinal cord. So, they are going to cross in the anterior white commissure of the spinal cord, exactly where the syrinx is going to develop and expand, and here there will be syrinx which will be formed. So, what is syrinx? Syrinx is actually that cavity which is going to get formed, expand, and it is going to trouble the spinothalamic tract, and that's why there is loss of pain, there is loss of temperature sensation, and this loss is actually cape-like. So, like this, in this fashion, there will be the loss which will be there, okay, which is going to be there. So, what will you see in case of MRI findings? Please understand, MRI is diagnostic for Arnold-Chiari 1 and Arnold-Chiari 2. But there is something which is called as beaked midbrain. Now, why will you call it as beaked midbrain? Because can you see this? This is actually the beaked midbrain. So, beaked midbrain, why? Because you know that the brainstem problems, the brainstem issues are going to come when it is Arnold-Chiari type 2. Okay. So, just this you have to understand. But in type 1, there is only like more than 5 mm below the foramen magnum is the cerebellar tonsils which are going to come down. Coming on to the severity, of course, Arnold-Chiari 2 is going to be more severe, and type 2 causes significant neurological impairment and hydrocephalus. And what is the treatment? See, of course, in type 1, there is posterior fossa, which is smaller one. So, first of all, you have to do the decompression there and perform the CSF shunt, like I have told you, VP shunting in the chapter of hydrocephalus to take care or to get rid of hydrocephalus. Whereas, I told you in Arnold-Chiari type 2, there is meningomyelocele and stuff which is going to happen. So, we have to treat them surgically. So, surgical closure of myelomeningocele. Of course, CSF shunting and decompression has to be done. So, this is the mainstay of the therapy. So, this was a class where we discussed about the congenital malformation that is called as Arnold-Chiari malformation, which is actually very important when it comes to your hydrocephalus topic and other congenital issues. Okay. So, thank you so much for watching. We'll meet in the next class. Thank you.